the shot, 90% of you live within 5 miles of one of those locations.
Good evening, black people and all allies fighting for black liberation, black prosperity, and black joy. I'm Charles Blow, and this is Prime. Now, I'm just not a fan of that end up paying a price language you just heard Joe Biden use. It sounds to me too much like a threat, and maybe I could be okay with it if it was truly a choice in all cases, if there were no economic or racial barriers in many of these cases that are beyond a person's ability to choose. But we don't live in that world. We live in this world. Biden also repeated this point that 90% of Americans live within 5 miles of one of the 80,000 vaccination locations, and that is good. That is great. No doubt about it. But we all know how poverty and race intersect with healthcare, and it does so in a deficit. Communities of color looking to get vaccinated still face various hurdles like limited internet access, limited access to pharmacies and hospitals, and limited access to transportation. Focusing solely or overwhelmingly on hesitancy runs the risk of erasing these very real hurdles. The president also tried to clear up some of the confusion around the CDC's new mask guidelines, and oh boy, is there confusion. Maybe it's not confusion, maybe it's just us experiencing whiplash. We're now being told it's okay to do things that only the reckless and irresponsible people had done before, which is to not wear a mask or social distance. Earlier today, I had a chance to speak with the authority on these subjects, the nation's leading expert on infectious disease, Dr. Anthony Fauci. Take a listen. Last week, the CDC lifted masking and social distancing requirements for the fully vaccinated in most situations. Do you believe that this is the beginning of the end in this country?
Well, I believe it can be. I think the one thing that we really need to be careful of, that we don't declare victory prematurely. We are certainly on a track for getting to the point where we can get to some degree of normality gradually, little by little. And the road to that and the solution to that is vaccination. Because right now we're on a very good track for implementing vaccines. When you talk about, for example, people 18 years of age or older, we have about 59% of them, close to 60% of the people have received at least one dose. That is really good news. And if we continue along the pace we're having now, we will almost certainly reach the president's goal of having 70% of adults having received at least one dose by the 4th of July. If we keep on that pace, I think we would be actually correct in saying we're really on the road to getting back to a substantial degree of normality.
The country's largest union of registered nurses and National Nurses United has condemned these new CDC recommendations as, quote, not based on science, and is calling on the agency to, quote, do the right thing and revise its guidance. What is your response to that?
Well, I think that's being a bit harsh and unfair to the CDC. As the CDC has stated, what has happened over the last few weeks is a really solidification of the data in the following areas. The vaccine effectiveness in the real world is really even better than what we saw with the clinical trials. So right now we're dealing with highly effective vaccines. Number two, they also appear to be quite effective against the variants, which was one of the reasons why there was the concern about keeping masks on in the various circumstances. So that's the other point. And the third point is also important. As more and more data are being accumulated, it is clear that if you are vaccinated and you get a breakthrough infection, namely you still get infected and you don't get any symptoms, the chances of transmitting the virus to someone else is very, very low. So with those three things now being very clear on the basis of scientific data, then that's the reason why the CDC made that decision.
So as Americans out there listening to this, they're listening to the largest group of nurses saying this is a problem and it's not based on science, and there's a CDC, which is not the people coming to closest contact with them. I just want to be clear here. Is this nurses group wrong in their opposition to this guidance that the CDC is delivering?
Well, Charles, I don't want to be in the position of criticizing a nursing group that I have a great deal of respect for, but I think if you look carefully at the data upon which the CDC made that determination and that guideline recommendation, I think you're going to see that there will be agreement. One of the things that I think is an important criticism, it has some degree of justification, is that the science associated with the decision is sound. How it was rolled out and people got surprised by it, I think is the thing that's the issue. And that I hope within the next couple of weeks at the latest, the CDC will be coming out with, again, more specific guidelines about various circumstances. That could be the workplace, that could be the travel, that could be a variety of other things. So I think the issue is how it was rolled out versus the substance of what it actually was. And I think that's where the disagreement is.
This weekend during Emory University's commencement, you said this: our country's experience with COVID-19 has not only upended our lives, but it has uncovered a stark reality and failing of our own society: the unacceptable disparities in health experiences by minority groups, especially African Americans, Hispanics, and Native Americans. You went on to say that many minorities have a much greater risk of COVID-19 due in part to comorbid and medical conditions that lead to increased hospitalizations. And you pointed out, quote, very few of these comorbidities have racial determinants. Almost all of them relate to societal determinants of health dating back to disadvantageous conditions that some people of color find themselves in from birth regarding the availability of an adequate diet, access to health care, and the underlying effects of racism, undeniable effects of racism in our society. Are you saying here that the racial disparities of COVID-19 are in part a medical manifestation of a systemic racism in this country?
Yes, I was pretty clear about that, Charles, and I don't think it's, and that's why I used the word undeniable. I mean, there are people who don't want to admit that. But if you look at the social determinants of health, it's the position that people of color have been put in for decades and decades, if not centuries, where in fact they're put in a position where the social determinants of health, the things that contribute to your health, the availability of an adequate diet, the availability of good medical care to pick up hypertension when it's first should be detected and treated. Not that when you have a 40-year-old black man coming into the clinic who's probably been hypertensive for 10 or 15 years and already has the serious consequences of that. I think that's undeniable. So I said it because it's true. And I think one of the things we need to do, as I mentioned in the commencement address, is that the social determinants of health were in place decades and decades and decades and influenced brown and black people from birth. So it's our responsibility to make a commitment that looking forward, we're going to turn around and undo those social determinants of health. And that's going to take a decades-long commitment. That was my message, and I feel strongly about it.
Black people are less likely to have been vaccinated than other groups. Almost all of the emphasis around this has been placed on vaccine hesitancy, and very little has been placed on racial barriers to access, like longer distances to vaccination centers and lack of computers to register for vaccines where registrations are required. As 538.com put it in March, quote, blaming the gap wholly on distrust is dangerous because it puts the onus on black Americans around vaccinations and distracts us from the real reasons why the inoculation rate is lower. How much of the racial gap in vaccinations do you believe is a choice that black people are making, and how much do you believe is related to racial barriers over which they have no choice?
I believe that some of it, and we've been able to get around that, is related to the situation of their own choice because of their concern and understandable hesitancy related to the history of how the federal government and its programs in health have a not exactly laudable history when it comes to brown and black people. That is now something that will not happen again due to the ethical constraints. But I agree with what you're saying completely. A lot of it has to do with access. And that's the reason why a very important part of the vaccine rollout program is the issue of equity. It is built into what we're doing right now. So if you look at all of the implementation programs for the delivery of vaccines, it's very heavily weighted towards making sure we get equitable distribution. That could be the community vaccine centers. That could be the 40,000 pharmacies that are located in areas that demographically have a high representation of brown and black people. That could be the mobile units that go into areas that are not easily accessible. So clearly, equity of accessibility of vaccines is an important reason why there are less brown and black people getting vaccinated. But we're doing better on that, Charles. If you look at what's happening over the last several weeks to a month or more, we're getting more and more brown and black people vaccinated, particularly among the elderly group, where there's in fact no difference in the vaccination rate among brown and black elderly people and white elderly people.
After a quick break, we'll have much more with Dr. Fauci, including his biggest regrets and his thoughts on the lies that fueled this crisis. More Prime in 2 minutes. In the second part of my conversation with Dr. Fauci, we discuss his biggest regret regarding the pandemic, how misinformation impacted fighting the virus, and the racial parallels between COVID-19 treatments and HIV treatment. COVID-19 and HIV are so vastly different diseases, in many ways not comparable at all, but you have been deeply involved in the fight against both of them, and both of them have extreme racial disparities. Do you see any parallels in racial outcomes between these two diseases?
Well, there's no doubt about that. I mean, if you look at the situation with HIV, which we've discussed so many times, 13% of the population is African American. 44% of all the new cases in the United States are among African Americans. 65% of those are among men who have sex with men, and 75% of those are young men who have sex with men who are African American. So the disparity is profound. It's profound for a number of reasons. The stigma associated with it, the lack of accessibility of things like pre-exposure prophylaxis, which can prevent people from getting infected in a very efficient way. If you look at, on the other side of the coin, COVID-19, it's the same thing. The jobs that brown and black people have themselves in, understandably, put them out into the society because they're generally essential jobs for running in society, which means they come to exposure of people. Once they do get infected, as you mentioned just a few moments ago, the social determinants of health, because they have a higher incidence of diabetes, hypertension, obesity, chronic renal disease, when they do get infected, they have a much greater likelihood of getting hospitalized and even dying. So there are very many similarities between HIV and COVID-19 when it comes to the health disparities among black and brown people.
Do you worry that the same kind of losing focus among media and the public overall will happen with COVID-19 the way it happened with HIV, as you know, the people who most affected shifted away from the white population to the black population? People don't talk about it as much, don't write about it as much. Are you worried that that same problem will occur with this disease?
Well, you know, there's that possibility, which is the reason why I and my colleagues keep bringing it up. This is something you can't walk away from, you can't hide. And that's what, you know, you were talking about one of my commencement addresses, Charles, and that's the reason why in virtually all, I've done several commencement addresses this year, in virtually all of them, I either directly or indirectly refer to that. That's something we really need to pay attention to. This is a glaring failing in society, which is the disparities that we see. We have two major global pandemics that we've had to deal with in my professional lifetime. One of them is HIV, and the other is COVID-19. And both of them shed a very bright light on the disparities that we see in health when you're comparing brown and black people with the rest of the population.
Dr. Fauci, I want to ask you personally, what is your biggest regret about something that you said or did during this fight against this virus?
It's a regret only because of how it was interpreted, Charles. It isn't necessarily a regret in having said it. And that has to do with early on when we were deciding whether or not we should be asking people to wear masks. It was in the context of the fact that there was felt to be a shortage of masks, and that if we recommended that everyone wear masks, that in fact it would take away from the supply of the people who really needed it, namely the healthcare providers. Number two, there was no evidence that it was effective outside of the hospital setting. We didn't know if it worked out in the community in preventing acquisition or spread. And, thirdly, we didn't really fully appreciate that a considerable amount of infection was spread by people who have absolutely no symptoms. So back then, we said it isn't really necessary to wear masks and we don't recommend it. And had we known then what we know now, that A, there is no shortage, cloth masks work very well. B, we have a lot of data now that said that outside of the hospital setting, that masks actually are effective. And three, we know clearly now that 50 to 60% of infections are spread by people who don't have any symptoms. Knowing that now, we highly, highly recommended and have been recommending for some time now masks. So again, back then, had I known what the facts were of what we know now, I would have not said that. I would have said, well, we should wear masks, but we didn't know it then.
So, as you're laying out, recommendations are going to change as our scientific knowledge of the disease changes. But how damaging do you think that is for the public to see those changes and see reversals?
Well, I think it can be detrimental if the public doesn't fully understand that science evolves, particularly when you have an outbreak that started off as a complete mystery. And then as the weeks and months went by, we learned more and more about it. And I think what the public needs to understand, and it's understandable why they don't understand it, because that's not something that they deal with every single day. But when you're dealing with the evolution of a brand new disease, you've got to have the humility and the flexibility to change what you say, to change the guidelines as you get more and more. If we were dealing with a static situation and nothing changed, and yet you changed your own ideas and guidelines, that would be categorized as flip-flopping. But if you change your ideas and your guidelines as new scientific information, data, and evidence come, that's the appropriate thing to do. And sometimes that gets misinterpreted by the public because they say, well, you're giving mixed messages. No, what you're doing is that you're guiding yourself by the information as it evolves and as new information becomes available. That's just the nature of science and the nature of using science as a backbone or as a guidance for what you say and what you do.
That change in position is completely different from people who intentionally did not tell the truth. In your estimation, what percentage of lives lost to COVID in this country could have been saved if all officials had simply told the truth about this virus from the very beginning?
Charles, I can't give a numerical estimation of that. The only thing I could say is that it has not been helpful, as it were. When you deny that this is a serious problem, when you say it's going to go away, it's going to disappear, when you do things like proclaim that certain interventions really work and are life-saving, when there's absolutely no scientific data whatsoever that it works, and in fact the scientific data indicate that it doesn't work. All of those things, denial that we have a serious issue. We've had situations where right in a particular city or a town where there's people in the hospital dying from this infection and this disease, that people still think it's fake news, that it really isn't the truth. Those kinds of things are certainly not helpful. I can't give you an estimate of the number of lives or illnesses that would have been avoided, but I'm certain it's not helpful when you have that distortion of the facts.